Great. Welcome, everyone. Thanks again for joining. My name is Nicole Weber, and I'm the director for the ProWash activity. ProWash is funded by USAID Bureaus for Humanitarian Assistance and is led by Save the Children. We aim to provide support to implementing partners to strengthen the quality of WASH interventions through capacity strengthening, knowledge sharing, and applied research opportunities. To learn more and to see some of our resources and training materials, you can visit the FSN Network website by clicking the link in the chat box. For those who just joined, welcome to this peer-to-peer learning event about leveraging market approaches to sanitation. We'd like everyone to be aware that we are providing French interpretation for this event. If you would like to follow the event in French, you need to click on the small globe at the bottom of your Zoom screen where it says interpretation and then select French. Once you have selected French, you can choose to mute the original audio or you can hear it in the background at a lower volume. As part of ProWash's applied research activities, we worked closely with the SHOUHARDO 3 Resilience Food Security Activity and iDE in Bangladesh in 2019. We supported rigorous human-centered design, formative research, rapid prototyping, and participatory in-depth interviews. The link to this study report is in the chat box, and this study was used to inform the sanitation market strategy for the Resilience Food Security activity. Now that a few years have passed, we're excited to have iDE and CARE with us today to share lessons from implementation. Before we begin, I'd like to introduce today's presenters. Deepak is country director in Bangladesh. Deepak leads one of iDE's largest and most innovative portfolios, expanding iDE's work in WASH, nutrition, private sector engagement, and integrated gender programming. Deepak has extensive decade-plus technical and leadership experience in designing and implementing projects in Nepal focused on private sector market development and access to financial services for low-income clients and a wide variety of agriculture value chain strengthening initiatives. Saroja is the Associate Director of Programs for iDE and is focused on private sector market growth. She currently provides strategic and technical guidance to iDE Bangladesh programs, including 3 major WASH programs on sanitation marketing under the WASH portfolio. Afrahil is Deputy Chief of Party for SHOUHARDO 3. She has over a decade of experience in the humanitarian and development sectors, focusing on design, implementation, monitoring, and strategic communications. She has worked in Asia and East Africa and has since managed programs based on evidence from research and learning, collaboration, and adaptation. She has expertise in strategic management and technical support to programs and donor reporting. So welcome everyone again, and I'd like to hand it over to our presenters to dive into today's topic.
Thank you, Nicole, for the introductions. Good morning, good afternoon, and good evening to everyone joining in from various time zones. I'm Saroja Thapa, Associate Director of Programs with iDE based in Bangladesh. I'll start off with a short background of iDE and our technical approaches. iDE is an international NGO headquartered in Denver, Colorado, that spans offices in 11 countries in Asia, Latin America, and Africa, creating income and livelihood opportunities for rural poor households in agriculture, WASH, and access to finance. Our focus is on applying market-based approaches, working closely with the private sector. So basically using business as a means to reduce poverty and improve incomes and livelihoods. Bangladesh was our first country program, which started 38 years ago, working with the private sector on the commercialization of the treadle pump. On the slide you see we have at iDE, what we have is we call our 4 key pillars of our approach. First, we start with people using human-centered design methods to understand people's lives and their barriers and accelerators to accessing safely managed wash services. Then we design to context. We believe that the development efforts, particularly those related to markets, cannot be a cookie-cutter approach, but rather has to be designed specifically to the context that we work in. And you'll hear more about this during the next segment of our presentation from Deepak. And then we believe that business can deliver social returns. We mobilize the private sector by building a strong business case for marketing wash products and services to the poor. We reduce the risk of market entry for local wash businesses and entrepreneurs and build connections between these key market actors. And finally, we are proud of the fact that we are considered a market leader in using evidence-based decision-making process. We collect and analyze real-time data on quality, cost effectiveness, and performance using a cloud-based information system, allowing us to prioritize investments in our wash interventions that work and eliminate those that don't work. Next slide, please. On this slide, we will talk about sort of what different markets versus different models, right? Across our country programs, we follow our 4 pillars as I highlighted in the earlier slide, but the outcomes of those are quite different in, sorry about the noise, about how we apply to the real context. Our programs range from an active presence in the market, such as our social enterprise, Hydrologic in Cambodia, and Sama Sama in Ghana, to more of a facilitative approach in Mozambique and Bangladesh. This really depends on how ready the markets are to respond to the needs of the community, and also what gaps we see as a program that needs to be addressed. Next slide, please. In terms of our key performance indicators across our country programs, we look at 4 major key indicators that provide us with a holistic picture of what we've achieved so far. Since our engagement in the wash sector approximately 15 years ago, we have reached over 9 million individuals through a variety of our wash technologies and services. We have actively sold 2 million wash products through various market channels. We've also created a net value addition of $11 for every dollar invested in iDE by leveraging market interventions, investments for better household outcomes. And finally, we have created net savings in health cost of more than $150 per household for all the households that have used our wash services and technologies. With that, I hand this over to Afril from CARE for her presentation on SHOUHARDO 3 project in Bangladesh.
Thank you so much, Saroja. Good evening from Dhaka. I'm Afril, the Deputy Chief of Party for CARE SHOUHARDO 3. I am just here to present an overview of our partnership with iDE and what has been going on with the WASH initiative for SHOUHARDO. In the next slide, you will see a short video of the areas on where we currently work. As you have seen in the video and detailed in the slide, we operate in a very geographically challenged context in Bangladesh. The Haors in particular are submerged in floodwater for 6 months every year, while the chars can be located in very extreme locations that face challenges in infrastructure, communication, and transportation. Next slide, please. So SHOUHARDO, as already explained by Nicole earlier, is a resilience food security activity, which stands for strengthening household ability to respond to development opportunities. The program started in 2015 and already we are already on our 7th year of implementation following the cost extension that was approved by USAID a couple of years ago. In 7 years, it has been the program has been through a lot, and halfway through the first phase, from 2015 to 2020, we had the midterm evaluation, and one of the major recommendations was to revamp our WASH strategy, hence our current partnership and engagement with iDE. So our target is to reach at least 168,000 households. And in addition to the geographical challenges that you saw in the video in the previous slide, there are also other challenges that we face in the chars and Haors, such as the power dynamics, social issues, poverty dimension, different forms of vulnerabilities, ecological and other natural challenges. So speaking of our cost extension phase, the major focus is to make sure that we put in place sustainable models for service provisions, which also is being covered by the current work with iDE. And second is to wean off the communities from the direct support, which we used to provide previously, and ensure that they access the available basic services for their livelihoods, health, and disaster preparedness, among others. And lastly is to make sure to influence the donors and peers and the government to continue with the results that we have established on the ground through the works that we have been doing since 2015. So that is the overview of the program. And I would like to hand it over to Deepak to explain more in detail how we are, how iDE is, of course, helping SHOUHARDO to make sure that we implement our current WASH strategy in the chars and Haors. Over to you, Deepak.
Yeah, great. Well, thank you, Nicole, for the nice introduction. Thank you, Afriel, for setting the background. Good morning, good afternoon, good evening, everyone. My name is Deepak. I work with iDE. I have about 15 minutes of presentation ahead of me, so thank you in advance for your patience. I will start by talking briefly about the design of this project and sharing with you some of the interesting interventions that highlights the market-based approach that iDE takes. We will then discuss our learning and then finally wrap up with some of the constraints that we have that is worth talking about in this webinar today. If you have any questions during my presentation, please feel free to add that into the Q&A box or to the text box, and we will get to that as this session is done when Nicole starts the Q&A section. So let me begin this by reiterating what my colleague Saroja highlighted earlier. We did invest quite a lot of time and resources in the front end in the designing of this project to the context in which it is implemented. And the video that Afriel played provides an excellent glimpse of that context. For those who are not familiar with the chars and Haors of Bangladesh, it is indeed a very remote and fragile areas to work in. During the initial phase, we came up with 3 design, well, I would consider it key design elements in coordination with our colleagues at CARE. The first one was focused on the demand side of the households that are in hard to reach areas, therefore have limited access to and awareness of technologies related to improved latrine. What even means an improved latrine was a big challenge there to explore. We had to focus on developing interventions that would address this barrier. The second one was focused on the service delivery model, which is again limited given the geographical locations of these areas, where our commercial partners do not always find this to be a profitable market to enter. Our interventions have focused on building local market ecosystems and building their supply capacity to provide appropriate products and services. And perhaps more importantly, the third element was ensuring that there was a business enabling environment supporting the overall transactions between the consumers, the buyers, so in this case, as well as the retailers, the sellers of the technology, including looking at possible ways to engage third parties, such as financial service providers or the government of Bangladesh for public subsidies, and better coordination between local government actors and our commercial partners or commercial entities. So that was setting the design context. Next slide, please, Suzanne. From the beginning of the project, we were very cognizant of the supply side and the demand side barriers. Broadly, from our lessons in facilitating the sales of wash products to low-income clients in Bangladesh and elsewhere, and more specifically in the context of the chars and howars. And there were quite a lot of constraints, as you can see, ranging from lack of affordable options to limited awareness, or even limited resources to procure and to supply these technologies and latrines. And if you've already worked on a market-based project that caters to extreme poor households, you yourself will know that selling to these categories of consumers is not an easy task by itself. In most of the cases, these market constraints were not new to our work at iDE, and we had broad solutions that we tested and fine-tuned for this project. One of the major issues was identification of the right latrine producers, and I will talk a little bit about these people later on, who are local entrepreneurs with the skills and interest to get into latrine business, supporting them to start or expand their business, and encouraging them to adapt to the needs of the clients was a key part of this program. There were some additional constraints too that were oftentimes challenging. We used our ongoing sanitation project learnings to develop a low-cost, affordable latrine that would work in this context, and adapted our marketing campaigns to create awareness and demand for the products using SHOUHARDO 3's ongoing programs and platforms to do this. But personally for me, and perhaps in my opinion, the most interesting lesson and learning from this project is around the way in which sales interactions were conducted that led to quick adoption of technology and its proper utilization by the users. And this is based on our ongoing global work in building business ecosystems with local entrepreneurs. iDE has an ongoing partnership with an international US firm called Roy Partnership that delivers world-class training for salespeople. These trainings, they work ranging from training commercial firms to reach new markets to social enterprises looking to sell, for example, water filters. And the Roy team have worked extensively with iDE for the last 10 years, developing and perfecting a field-based sales training, not just manual, but a system that provides these entrepreneurs with high-quality skills to engage with their customers and convert these interactions into sales. We invested a lot of time and effort with these latrine producers and their sales agent to build their capacity and skills in these areas and develop an entire sales management system, which included client tracking, referral to sales tracking process that helps us analyze the sales pitch and points where they miss their sales opportunity and help them understand the consumers better. At the end of the day, no matter what you do on a market-based project, you can look at all of these broad constraints, but what happens within that 30 minutes between the potential buyer and the sales agent, that actually is the real deal. And that, I think, is quite an interesting takeaway for me. Next slide, please. The story, what I just talked about on the art of selling, is important, but perhaps it'll make more sense if I tell you what other components were in play during the design of the market systems intervention and what we achieved. This is a simple diagram of the supply chain of the latrine product across the major market nodal areas. And let me preempt this slide by saying that this project benefited from two key factors. First, at the national level, Bangladesh has a thriving construction industry, and most of the products and services needed for latrine installation are readily available. Our challenge was just to improve its supply in the chars and the howars, where remoteness and low demand restrict smooth flow of these supplies. And secondly, the project benefited because iDE has a national sanitation market development project that has been in operation for almost 7 years now. And a lot of these commercial partnerships could be easily developed based on our previous working experience in this sector. So for this project, we had to refine these partnerships and improve it for specific geographical areas. So on the left side, we start with the lead firms. In our case, we had an ongoing institutional partnership with Lixil, a global sanitary ware company that acquired American Standards, who now design a range of low-cost sanitation products, including the Sato pan and RFL, which is a Bangladesh-based private company that manufactures these Sato pans in the country. We also wanted to work with a lead firm in terms of developing financial services, but I will talk about that in our constraint sections later on. With the product now ready, we move to the various commercial entities that supply latrine installation items, from cements to bricks to corrugated tin sheets. We formed local level partnerships with more than 50 of these firms to ensure that they would be able to work closely with the latrine producers in our locations. The latrine producers themselves were formed into self-interest groups, or what we call the sanitation business associations. Based on our previous experience, we had realized that this network of LPs, or latrine producers, is an important mechanism that provides them with better negotiation platforms for supplies, for example, bargaining for better prices of supply for pans, cements, bricks, and better coordination when they receive large orders, whether from private entities or public entities, which issues public tenders at times. And finally, on the last mile connectivity side, which is on the right side, we have supported 75 latrine producers, and in return, they have hired additional 75 sales agents to increase their coverage. A large number of these sales agents are women, and we'll discuss this later as an unexpected result of the design. And all of this, the big question is, what is this for? And the result has been quite interesting for us. Almost 12,000 latrines have been sold, which has created new access for over 47,000 people to improve latrines. And now, before I move to the next slide, let me just kind of say that all of this happened when COVID was raging in Bangladesh. Severe lockdowns were in place, limiting our mobility. And we started this project almost 2 months later than planned. And this is the result of less than 2 years of work. Next slide, please. I've summarized quite a lot of lessons that we have learned into 5 broad thematic areas. I won't spend too much time on each of them, as I think that a lot of you have learned similar lessons from your own programs and interventions. I just want to highlight these for discussions during the Q&A session later. For us, lesson 1 was a very simple one. In remote locations, oftentimes supply and demand are seen as the chicken and egg dilemma, as in which one to catalyze first. This was definitely not the case for us in this context. We learned very quickly that if you increase access and availability, demand will increase. As soon as the latrine producers and the sales agent were active amongst the households, the sales orders started coming in. Lesson 2, again, something we all know, but worth repeating. We have to invest in understanding the behavioral determinants for each client segments. Assumptions are risky in these cases and often lead to wrong programming decisions. We recommend that all projects of this nature should allocate adequate resources upfront for this. This is worth the time and investment and will improve your project's effectiveness in the long run. Lesson 3, we have seen from our project SWIRL that the latrine producers are taking a great risk, but a calculated one, to provide installment-based payment systems for their clients, which has increased the sales, obviously. If we could have had a financial institution to do this instead, this would have greatly assisted the latrine producers, who are often put into an impossible situation, having to choose between losing their sales opportunity or taking a risk to provide credit. Next slide, please. Continuing from the previous slides, 2 more lessons to go now. Lesson 4, we have unlocked the potential of a low-cost technology. In this case, this is called the sanitary toilet pan, or the Sato pan, which has now almost reached 2 million sales, unit sales so far. It is a low-cost technology, which is under $10 per unit, easy to manufacture, transport, easy to store, sell, easy to install, and easy to service. It checks all the boxes. we now need to broaden our horizon on some of the other elements of our latrine system, such as developing a more flood-resistant pit, what we call the substructure that sits beneath the pan, and the housing unit, or what we call the superstructure. And now with commercial firms globally coming up with new solutions every day, we're bound to find similarly innovative ideas elsewhere. And the final lesson, of course, is for the behavior change specialists. I saw a few of the people mention what they do, and I'm regretting putting this up as there will be questions later, which might be beyond my technical skills to respond to. But here goes it anyway. We found out, at least in this case, that we had better behavior adoption when environmental nudges were coupled with behavior change communication initiatives. And for example, the picture on the right side, what you see with the yellow latrine and the yellow footrest, by including hard ridges on the footrest of the latrine, clients remembered or were nudged to use their slippers instead of going barefoot to use the latrine. And this kind of learning has a greater applicability in terms of other settings, perhaps for hygiene behavior, including hand washing nudges. So that pretty much sums up our learning, at least in the broader sense. We will have some time during the Q&A session to revisit these if you want. Let me go to the next slide. And I want to briefly spend about 3 minutes talking about some of the things that continue to keep us up at night, things that we struggle with in our program, not just in the SWIRL project context, but also across our other sanitation program in Bangladesh and beyond. First of all, there is this major issue of post-disaster infrastructure damage and reconstruction. I mean, the picture on the right here says it all. Seasonal floods are quite common in these areas. However, there are incidents of high levels of damages once in a while that leaves these communities very vulnerable. The picture on the right is an example of such a situation where people have to choose between their lives and livelihoods. Most often, their lives are intertwined with their livelihoods. And in such cases, safeguarding latrine is not their priority. The bigger issue here is helping the community become more resilient. But from our narrow perspective of the situation and how it impacts the investments that the households have already made in improved latrine, we need to focus more on developing better technologies. The Satopan, to an extent, is flood resistance, I would say not proof, as one of the flap closes when the water from the pit rises. But when the water levels are beyond the latrine substructure, this is of little use. And we don't have an easy fix on this. Next slide, please. One of the reasons of the success of the sales component of the project, which we started just 2 years ago, has been the fact that SHOUHARDO 3, with its long history, provides an excellent platform for coordination and its ongoing livelihood support. Element builds the financial capacity of the households to be able to afford these latrines. As you can see from the picture here, the groups that have been supported by SHOUHARDO 3 provide an excellent way for the sales agent to reach these households. And as you heard from April earlier, the larger SHOUHARDO 3 ends in less than a year, and the iDE component ends much earlier by March 2022. We, of course, remain optimistic that the sales infrastructure that we have supported will remain in place. And there are already signs of that happening with the formation of the latrine business associations, sales coming from households other than the SHOUHARDO 3 target areas. But there will certainly be gaps created, and the absence of these project spaces may create some level of impact on the sales effectiveness or even the affordability of the clients, which is why the next and final challenge is even more important to us. Next slide, please. WASH loans, particularly latrine loan products. Now, recently, World Bank, along with the Asian Infrastructure Investment Bank, have co-invested $400 million with PKSF, which is a large microfinance and social development NGO to expand access to rural water, sanitation, and hygiene. And they expect to reach 1 million people with their sanitation outreach program. This should have been a welcome news to our sector, but there are some concerns that we have. We are particularly concerned that the socioeconomic structures of the communities in the Hawas and the Chars are different. They are transient. They don't always have a group of 20 to 25 members, which is a key success factor for MFIs. They don't always have a stable means of livelihoods to pay back their loans, as per a typical Grameen model requires, which is another risk for an MFI. As such, we worry that these groups might be left behind in the pursuit of bigger numbers from the MFI. Furthermore, existing loan products and the new ones being designed mostly focus on the demand side to improve affordability of latrines, but don't factor in the financial needs for the commercial actors. For us specifically, the latrine producers who need working capital, inventory credit, and other means to improve and grow the business. Therefore, we're a bit skeptical that just by increasing the demand for latrines through readily available latrine loan, though we welcome them, of course, for 1 million households, but it may not be a holistic solution. And with that, let me end my presentation with some happy thoughts. Next slide, please. As you know, the objective of our specific component that iDE worked on with SWIRL 3 was focused on improving access to improved latrines, and the gender component was more focused on the utilization of the latrines by women. However, as we started working with the latrine producers, almost all of them were male except for 2 female out of the 75 entrepreneurs. We found out that the latrine producers were very keen on hiring and retaining women sales agents. There could be many reasons for this, but how it affected our result is that women sales agents had an easier time getting access to households, specifically the women in the households, as you have seen from the earlier picture, attending the group sales meeting were mostly women, who often are the key influencers, if not the decision maker at the household level for purchasing the latrines. So this happens to be an interesting learning for us too, that the commercial actors, such as the latrine producers, adapted their business model quite quickly to suit their need and engage sales agents that would have greater access to the clients. And on that interesting note, I thank you for your patience and hand this back to Nicole as the moderator for the next session. Thank you.
Great, thank you so much for the presentations and for sharing all of your lessons learned with us. I've noticed a number of you have put questions in the Q&A. We have about 10 to 15 minutes now where we'll be able to answer some. We're going to launch a poll and we'd like to hear from you. Are you currently using market-based approaches for sanitation in your programming? Which of the lessons did you hear today that you might be able to apply to your own project? And what is the #1 challenge you face when using market-based approaches for sanitation? So please just take a minute to respond to our poll, and you can also drop any questions you have in the Q&A box. So I see as you start to do the poll, we'll go ahead and get started with our Q&A. My first question for Deepak is, what are 1 or 2 recommendations that you would give resilience food security activities who are just starting market-based sanitation? We have lots of partners that have joined today who are either just starting market-based sanitation or are curious to start in the future. So what are 1 or 2 recommendations that you would give them?
Sure. Pick the right partner, easy. Ensure that they have an ongoing or past relationship and credibility with commercial private sector partners. I think, for me, that would be perhaps the most important one, because, the ability to have a jump on the program, have a quick start, and not have to recreate these relationships from zero would be an important learning. Design to context. Don't cut corners during your design phase. Invest in that time and effort. Yeah, those would be the first 2. I have many more, but I will leave it there. I'm sure others have other points to add.
Great, thank you. The next question is for Afril. For the RIFSA, for the Resilience Food Security activity, what different skill sets did you have to build within the staff to implement these approaches over traditional community-led total sanitation? Did you hire the same wash profile or different?
Thank you for the question, Nicole. the question actually takes me back to the time when we were designing the cost extension proposal, because we were reminded again that such some skill sets will remain relevant in the course of the programming, but definitely people who have love for innovation, because definitely we are dealing with chronic issues in the chars and hours where we work, and how are we going to do things differently. And at the same time, that love for learning and making sure to internalize what other organizations have learned in the past, to adopt and make sure that we get to address the evolving needs of the vulnerable communities that we have on the ground, and always making sure to get in touch with the reality, because no matter how much things were planned, things can always happen. For example, there's always floods in Bangladesh. All these disasters that are coming in every year are always changing, plus the context of COVID-19. So that agility to adapt to different scenarios that we have, especially when dealing with the WASH issues, will be very, very important in terms of the skill sets that we have identified in addressing this kind of concern that we have. Thank you.
Okay, great. Thanks so much. The next question, how were the entrepreneurs selected? What are the incentives to invest on sanitation for the private sector? Deepak?
Yeah, sure. How were the entrepreneurs selected? If you remember what I said earlier in the presentation, we kind of benefited from having this thriving market ecosystem that is based on the construction boom that's going on in Bangladesh. So a lot of these entrepreneurs were not just people who were not used to the sector. They were doing ancillary work, perhaps doing some small civil construction work, making something out of cement, culverts, pipes, and so on and so forth. So our cohort of the first selections were people who were already existing, and then there were a few others who were interested but not started that business. So we had two broad groups, those with experience and those without, and a bunch of these technical and management trainings helped them catch up and become better at latrine installation and that specific business. And Nicole, there was a second question.
How were they incentivized to participate?
They were not. I mean, unlike a very typical approach of giving heavy subsidies for training, we mostly, because of our facilitation work, we work through the private sector. We work with RFL and other private companies who have their own business units reaching out to them. We nudge these people to go into that training. We show them the market size. We show them the potential for earning. And it also creates a filter that kind of weeds out the entrepreneurs from those just looking for a free handout. So I think, the other learning there, of course, is oftentimes you get wolves in sheep's clothing. I don't know if that's a good analogy to use, but people who may not be entrepreneur, but they're seeking free handouts, and you have a purposefully built-in screening system so that you are kind of really selecting the right entrepreneurs. And again, the development sector, we have a bad reputation of providing free lunch, quote unquote, right? So we have to get away from that behavior.
Great, thank you so much. How about for Saroja? It would be awesome to hear a bit about who the sale agents were and how they were recruited and trained. And what insights did you gain from the use of discount models in lieu of subsidies?
In terms of our sales agent model, we've used this across our other programs also, where they act as sort of the last mile delivery, right? Even in our other women's economic empowerment project, we've used a sales agent as a means of alternative sales channel. Similarly, in this project, we looked at women, especially when we're recruiting, we're looking at different criteria, but amongst the sales agent that project has trained, about 75, I think 60% of them are women currently. And for them, as it is a sort of additional income that they work with, and it's really, so our different in terms of the demand creation activities that the latrine producers conduct are through the sales agent. They do the group sales meeting, courtyard sessions within their own community. So women have been very influential in terms of sort of helping them sort of in terms of the decision-making process and sort of delivering that message. We've also found in SWIRL that there are 2 sales agents who've already, because of sort of the geographical, areas, sometimes the delivery cost tends to be expensive. So these sales agents have already created a sales point in their unions itself for the LP. So this has also been very sort of one of the results that we've seen in the project that has helped to sort of lower the delivery cost for some of these latrine producers. Did that answer your question? Or there was one more question around subsidies, right? In terms of the
Can I take that on the subsidies, Saroja?
Yes, please.
And there was another question, I think, from Kyla also on subsidies and the difference between discount and subsidies. Right, Nicole?
Go ahead.
And you know, this is an interesting one, and we've kind of borrowed heavily from commercial initiatives on this one. Very quickly, you know, subsidies often tend to earmark scarce resources and tend to build queues where people wait for subsidies to happen. So it's not a really effective mobilizer of investment decision. Whereas from a commercial perspective, discounts creates an urgency, especially when you use it in a time-bound manner. And it creates a sense of quick need to act. So if you say this discount, for example, exists for a certain period, then there's a certain action needed from a consumer to avail these discounts, as opposed to a subsidy and then creating a whole sense of entitlement. So, you know, we found out that, you know, fundamentally, they're not very different in terms of the financial benefits that a consumer gets, but it's how you phrase them and how you convert them into an action versus whether the agency resides in you or are you being affected by an external influence and you have to wait for somebody else to hand you a subsidy. So I think it was just a kind of play on a behavioral component there more than anything else.
Good, thank you so much. We had a couple questions around the price of the product. And so the question is, how is the price set up? Is it the private sector who decides the price, or is it the project that decided?
Oh, for certain, private sector. I mean, you know, we intervene as less as possible. If the price, well, first of all, the idea is to create an affordable product. And that's where the design engagement with the commercial partners starts, by seeing and fine-tuning where unnecessary items are not included and helping them research a better technology. But then once it goes through the market channels, you know, there are certain inbuilt costs that either the project has to subsidize or it just a market mechanism has to pay for it. And we prefer that for sustainability reasons, so that beyond the project's duration, it can still go on. We tend not to intervene in these areas, unless, of course, there is a certain need for a certain specific target group. And that too, there are other means than subsidizing those prices. There are many other tools in the toolbox.
And also, Nicole, if I may add, you know, in this case, it is set by the private sector for the slab. And then, you know, and to a certain extent, in our particular case, it's RFL, the private sector, in partnership with Lixil. To a certain extent, it's subsidized by them, and they take special care not to increase the prices rapidly, as they know this product is for the BOP markets. And also that at the end of the day, the latrine producer sets the price of the whole latrine package, as you know, including the other raw materials that's required for the rings and everything. Yeah.
Great, thank you. There were a couple questions around microfinance institutions, the role that they had in this project, and how you were able, if they were involved, how you were able to get them excited and interested in sanitation, which isn't typically an area of interest for a lot of microfinance institutions.
Sorry, Nicole, could you repeat that question?
There are a couple of questions that came in around microfinance institutions. How did you onboard microfinance institutions to offer loans or financing within the project?
You know, and it goes back to the presentation that I made, where we said that that was a challenge and a constraint that we continue to have, the short answer there is we did onboard some, but not to the extent that we would have liked to. And there were many reasons of that already explained. This is not a typical client group that they would like to engage in. But they are, having said that, there are some microfinance institutions in Bangladesh, which happens to be the birthplace of MFIs broadly, that are interested and they are willing to take the risk. They see the value in having a niche market segment that is looking for these kind of loans. So it is not all bad news, but I think in terms of scalability, more could have been done.
Good. And then I think we have time for one last question. So I guess maybe this one is for SHOUHARDO around scaling up or next steps. There's a question around if you were to extend the project, would you repeat a nearly 50-50 split between male and female entrepreneurs, or would you focus on women given that they had better access to the female clients?
Thanks, Nicole, for that. The focus on women has always been there, weaved in different layers of our programming. And based on the result from that slide, which Deepak showed earlier, it also encourages more women to engage with female latrine producers. And, it also, results to many other benefits from this initiative, such as women being able to take part in decision making, for example, for the purchase of the latrines, for example, and allocating savings to make sure that they get to set aside a portion of their income to buy the latrines that are needed in the areas where they live. So definitely the focus will be there. We are aiming to reach more, and like I said, it also, there's a ripple effect to that when we put the more focus on women moving forward.
Great, thanks so much. So before we go into the rest of the presentation, I just want to share the results from the poll. It looks about 3/4 of you are already using market-based approaches for sanitation in your programming. It looks like you're interested in applying lessons, most of the lessons that IDE and SHOUHARDO shared with us today. And then many of you are facing challenges around sales and marketing, access to financing and loans, and sustaining demand after the project ends. So I'm going to turn it over to Deepak for the rest of the presentation.
Thanks, sorry, trying to unmute myself, a perpetual problem in the Zoom days. Thank you, Nicole. Thank you all for such wonderful questions. I was actually looking at the chat box. So many interesting things. I wish we had more time to go through all of them. Unfortunately we don't, but again, please feel free to link us at IDE or at SHOUHARDO. We'll be happy to address these as and when they come in. So I'm back again, and I'm going to very briefly, we have very limited time, talk about a new tool that IDE is unveiling at the COP26 event this week regarding our latest work in understanding how market systems respond to external shocks and stresses, particularly those that affect our communities, and to attempt to measure the resilience of these systems, particularly market systems, and better develop programmatic interventions. Now, that was a mouthful. In a simple word, what we're trying to do is understand how market system as a system interacts with our communities, how it is vulnerable to stresses and shocks just like any other system, and how do we measure that to design better program ideas. We won't get into the details of the method. It is a very short presentation about this tool, and my colleagues will share the peer-reviewed journal article on this with you so that you can read it at your convenience. The MSRI, it's an index, so it's called the Market Systems Resilience Index, builds upon the household level resilience. By the way, this also was developed under the REAL Award in the USAID Center for Resilience, and the guidance, the USAID Bureau of Food Security released guidance on market systems resilience, MSR measurement in 2019. And what we've been doing is working on converting this into an actionable tool for our own use. This includes our work in Nepal, Mozambique, and our collaboration with FCTO and EU in Bangladesh. under this SHOUHARDO project. Next slide, please. So the USA Bureau of Food Security's guidance on market system resilience makes a very poignant connection between resilience being the ability of people, household, community, and systems to mitigate, adapt to, and recover from shocks and stresses, and the fact that the market systems are equally vulnerable to these stresses and shocks, because we often don't tend to think of it that way, and the fact that vulnerable market systems can perhaps leave a large gap in our efforts to improve community and household resilience. So that is the basis of our work here. Next slide, please. The Market Systems Resilience Index, the MSRI, that we have developed builds on ongoing research and learning of the resilience framework from a variety of different organizations. There has been a lot of effort from organizations, and I will perhaps not do justice if I don't say at the very least, such as FAO, Mercy Corps, Food Security and Information Network, and many others who have developed tools such as the AAA framework, stress, goal methodologies that seek to provide a conceptual framework as well as methods to collect and analyze data, and not to mention the SHARP framework and the ACDI Boca's own market systems diagnostic tools. So a lot of this has been done. As such, our Market Systems Index uses a holistic approach to measuring the resilience of the market at multiple levels and accounts for various exogenous factors, for example, the ecological, the environmental factors, in contrast to the tools available. So it is basically, we've done a lot of review of the literature and found overlaps, gaps, and created a tool that seeks to address some of this from our perspective. Next slide, please. So this is what it looks like in a snapshot. We measure market resilience under 5 principles. Broadly, the structure, support, environment, connectivity, and financial. And there are 11 determinants. These determinants, not to go into details, but they range from gauging where the market has redundancy, so as to ensure that there's a surplus or options are available for consumers at times of the need, to other determinants like a feedback loop, so as to gauge whether the market actors are learning from each other and each other's behavior and adapting to the context. The journal article, like I mentioned before, provides more detailed reference on who these indicators are, how these indicators are developed, weighted, and calculated into an index. And like I said earlier, we've used this tool in Nepal, Mozambique, and Bangladesh, first to get a baseline value for the index. And based on that, we have revised our project interventions and will complete another round of measurement at the beginning of 2022 to see if our interventions have helped improve the resiliency of markets. And finally, here's a tool in action. Next slide, please. We use this in our project with FCTO and EU in Bangladesh. This is a project called SHOUHARDO. During our initial baseline survey, we found out that for aquaculture, which is one of the main source of livelihoods for many poor households, the low level of redundancy, there's a little score there on the top of redundancy, in the lack of availability of market inputs, such as fingerling, fish feed, and medicines, and the other vulnerability of the physical infrastructure for rearing fish, coupled with the lack of proper technology to prevent loss during floods that's available to the market, made that a very fragile sector for investment. So that was an eye-opener for us. And for us, using tools like this in the SHOUHARDO context, within the WASH context, really helps us kind of further have a sophisticated understanding of how the markets are coping with the changing world that we live in now. Yeah, so that's pretty much it on the MSRI. Thank you so much again, Nicole, Afrel, and everyone for giving us this opportunity to present our ideas. Back to you, Nicole, for anything else that you want from me.
Great, thank you so much. Thanks for sharing an overview of that new resource. I want to thank everyone for your participation today. It's great to see how many questions we had come in from participants. We'll work with SHOUHARDO to make sure we get the recording out to everyone, the presentation, as well as some of this Q&A. Please take a look at our website and look at our calendar for next year. We'll be scheduling other opportunities to continue the discussion around market-based sanitation. So if you sign up for our newsletter, you'll be the first to hear about these events that we will hold again in 2022. So thanks so much again, and thanks to our presenters for sharing all of your expertise with our partners. Have a wonderful rest of your